and welcome. I'm Teresa and I'm one of the directors here at Warren House Vets, and in today's video we'll focus on laparoscopic assisted cystotomy in a canine patient. Cystotomy is a surgical procedure performed in dogs to open the urinary bladder. It is commonly done to remove bladder stones or tumours, less frequently for treating congenital anomalies or in trauma. Bladder stones vary in size, and for smaller multiple stones we can do less invasive operation via keyhole access. In larger stones or cancer, it is often necessary to perform open surgery. This video focuses on laparoscopically assisted cystotomy for bladder stones. Firstly, symptoms and signs of bladder stones. Dogs with bladder stones often experience difficulty and discomfort while urinating. They also tend to urinate more frequently without actually producing that much urine. You might also notice blood in the urine, which is called hematuria. Bladder stones can irritate the lining of the bladder and cause minor trauma to the mucosa, leading to bleeding. You notice it as a pink, red or brown urine due to the presence of the blood. Another worrying sign is excessive licking of genital area, indicating discomfort or irritation. Dogs may display signs of discomfort, restlessness or general unease. These symptoms are not specific, which means they are associated with a range of other urinary conditions. Stones can be radio-opaque, which means that they are visible on X-ray, or they will show frequently on ultrasound where they disrupt the ultrasound beam. Not all dogs with bladder stones need surgery. In smaller stones or certain types of stones related to diet, vets can start with a prescription diet. Specialized prescription diets are available that are formulated to dissolve certain types of bladder stones. These diets work by altering the pH, the acidity of the urine, and dissolving the stones over time. Sometimes the stones are concurrent with urinary infection, so antimicrobial treatment is advised, although that usually doesn't solve the issues with the stones. In certain cases, medical treatment fails. In some, where there are large stones, it's not even recommended, and surgical removal is the gold standard. This can be done as an open surgery, where the surgeon gains access into the abdomen and bladder through a large cut. Alternatively, for selected cases, we can perform laparoscopically assisted operation. When we speak about laparoscopic or keyhole procedures, it means the operation is done through small incisions. When operation is laparoscopically assisted, it means that we start off laparoscopically, but at some point we need to make a slightly large incision than the usual 1 to 2 centimeters. As a result, the patient has smaller wounds than after the open surgery, which still translate into quicker recovery and better healing. Cystotomy for stone removal is done under general anesthesia, so disregarding what approach is selected, open or keyhole assisted, the patient is pre-medicated, clipped and anesthetized using propofol or other agents. Now let's focus on the laparoscopically assisted approach. Through small incision, the abdomen is entered and the abdominal cavity is visualized. Bladder is secured with suture to the abdominal wall, and then through small opening the surgeon passes the camera as well as the instrument into the bladder. Under direct vision, stones can be removed one by one, or they can be flushed out by suction. Since the opening is small, you can see why this is not a beneficial approach for large stones. Small and furthermore multiple stones are on the other hand easier to visualize and can be removed with laparoscopic grasper or, as I said, using suction. Once all the stones were removed, we still tend to do an intraoperative X-ray before closing to ensure no stones are left behind. At times when stones are not very radio-opaque, it's not completely 100% accurate. This is where it's very useful to know why the stones occurred or what they were made of, because unless the underlying cause is corrected, they can recur, unfortunately. Many patients require lifelong dietary changes or even medication to optimize the acidity of the urine. We hope this video gave you more understanding of the cystotomy in dogs. Thanks very much for watching and see you next time.